Just to do a slight managing of expectations. Artificial intelligence, it is a very much a very hyped form of technology, and a large portion of my work consists of trying to manage the expectations concerning artificial healthcare. Basically what I do for a living is talking. I wake up in the morning, I start talking, and usually somewhere around the evening when my wife asks me to shut up, I stop talking. And it is what I do for a living. And what I mainly do is I talk to doctors and nurses and boards of directors and governments on what artificial intelligence can and cannot accomplish in healthcare. So to start off, what artificial intelligence is not. It is not a magical I win button. And it might seem a bit childish, but there are people who view AI as a quick win. So they think, well, if I just find a very smart data scientist and get him to make an algorithm, then we can solve everything in our hospital and everything will be fixed and we will be winning. This is obviously not the case. What AI absolutely is not as well is it has nothing to do with robots or giant robots. And for some reason, every AI conference I visit, every presentation I see, it always has a picture of either an exploding robot head or people staring at a glass screen with some equations. And I don't know why people associate AI with robots. It has nothing to do with robots. But I always try and sneak in at least one picture of a giant robot just because it usually it does really well. And the last thing I want to say about the misconceptions about artificial intelligence is that it is often seen as a black box. And I don't really agree with this view of artificial intelligence. Artificial intelligence, it's a form of technology. It's more or less advanced statistical analysis. And like any form of technology, it is one of the tools available to people. Now, when I get in my car and I start the engine, it works and I can drive from A to B, but I don't really know how the engine works specifically. But I don't say that my car is a form of magic black box that I don't understand, and I don't question the ability of my car to take me from A to B. But it is something that is still happening with artificial intelligence. Doctors, nurses, and patients, they have some reservations about allowing artificial intelligence in a healthcare setting. And I can understand some of the reasons behind their questions. Now, what is very essential to understand in the implementation of AI in the healthcare setting is that the healthcare setting is always very ambitious and they like innovation. And ChipSoft as a company, we make electronic health record software. We are already very focused on innovation as well. And now this picture might not seem very innovative to most of you, but this was state of the art back when we started more than 30 years ago. But hospitals are still some of the places where people still use a fax. And I don't know if you all know what a fax is. It's some ancient form of technology used to communicate information, but they still actively use a fax in the hospital. So why is that important for AI in a healthcare setting? The software we make is different from the software we use in the financial sector or in entertainment. The software we make is actively used to help make decisions that decide whether people live or die. So imagine being in a hospital in an operating theater, being the person on the table, and I've had the misfortune of actually lying on one of those surgery tables. And imagine that the doctors and nurses, that they not only use medication or their medical tools, their saws and their other types of instruments, but they also use software and they use artificial intelligence to help decide what is going to happen with you. Are you going to live? Are you going to die? Will you suffer a severe complication? Those are the settings, those are the decisions that we have to think about when we create artificial intelligence software that is being used in a healthcare setting. Now, we don't do it only as people with a technical background. That would be rather strange. We work in a multidisciplinary team. So in my team, I have people with an IT background. We have data scientists, data engineers. We also have doctors and nurses. So this is Ruud. He's one of my colleagues. He's a medical specialist. He has more than 25 years of experience of working in a hospital, and he's been working with ChipSoft for a long time as well. And he's one of the people who always thinks with us when we try to create software that we want to implement in a hospital. So we always approach problems not only from a data science perspective or from an IT perspective, but also from the medical perspective. So why is AI such a challenge to actually get working on the workflow in a hospital or in a different type of care institution? That is because people still have some misconceptions, and usually it is that they can solve any type of problem using AI. And this is a quote I've used before, and I'm reusing it at this moment. When something is wrong in your hospital, you're not usually going to fix it with a neural network. So if you want to get a coffee and the coffee machine is broken, you don't try and code your way out of it. You usually call somebody who comes down with a wrench and fixes it, unless you're talking about predictive maintenance, but that's a different thing. So AI is not going to be the solution for every type of problem you are encountering in your hospital. And there's a lot of issues and challenges as well, things that can go horribly wrong and that do go wrong. And not wrong that patients die, but more challenges around things like privacy or performance. So some famous last words I've actually heard mentioned in task forces or work groups. I'm sure they won't mind if we use their data, and this is patient data, personal private patient data. Or this AI model is so good it's going to replace doctor, insert name here, when that specific doctor is present in the room. Or let's think about our model first, and then we'll look at the EHR integration later. Those are all things that might sound logical, but they are a recipe for disaster. And when it comes to AI in healthcare, people have really strong opinions, especially doctors and nurses who have multiple or tens or dozens of years of experience. They want to be in charge. They don't want to have the feeling that they will be replaced by some type of technology that they do not understand. So why is ChipSoft working on AI then? We are the market leader in both the Netherlands and Belgium. I think 80%, even more, of the hospitals are all using our software. So we already have the platform, and on the platform we have the data available, the data that is absolutely essential to make the AI work. So what we do is we use our EHR platform, HIX, to integrate the forms of clinical decision support in the work process of the doctors and nurses. And the core concept is that we are assisting and not replacing. That is why I always use the term augmented intelligence instead of artificial intelligence. It's not some form of robot doctor sitting next to you that is second guessing you. It is just another tool in your tool set available to help you treat your patient in the best possible manner. So like medication, like the surgical equipment, AI is a tool that can be used to extend your knowledge and reach. Third, actionable clinical decision support. An AI model is worth absolutely nothing if the result it is delivering is not actually in your clinical workflow. So every type of AI model that works outside of an EHR system is more or less doomed to fail, because every extra type of action a doctor or nurse has to take to actually view the clinical decision support is one too many. And you can imagine if you're standing in an operating theater and your patient is bleeding out, or you have to make a decision on which type of medication to prescribe, you don't have the time to walk to a different computer, start up a different system, or open a web browser. You want to have the information available within one screen, the screen you're using at that moment. Reusing of clinical data. The EHRs contain an enormous amount and wealth of data that is available, but it is rarely being reused at this moment. And making use of that data and actively using it to increase the outcomes of the patient care is one of the core focuses of ChipSoft at this moment. And last of all, it requires what I call easy healthcare ICT. So when you're a hospital or a doctor and you want to implement an AI solution, you should be focusing on what it can bring to you, what it can help to assist in your workflow, not the type of technical requirements that are necessary. So one of the core objects of ChipSoft is to make sure that the healthcare ICT part is taken care of and that our clients can focus on the innovation aspect. Now, simplifying healthcare ICT, it sounds really simple, but it is basically focused on taking the data available in an EHR and reusing it as often and as most efficient as possible, and facilitating all those different healthcare professionals using that software. It has to do with standards, because if hospital A is talking about standard A and hospital B about a different standard, they won't be able to communicate. And finally, it has everything to do with implementation. And that is the biggest challenge there is in the implementation of AI in healthcare at this moment, that it rarely leaves the phase of a academical concept. There are very good data scientists, very good students, very good startups, and they have very good ideas, but they usually strand somewhere before the implementation phase, because they have the intelligence, they have the ambition, but they don't have the knowledge of ICT or networking or hardware or the right network in getting their innovations actively used by doctors. So to give you an example on how we work towards getting that AI actually implemented, this is just a picture with on the left-hand side a setup at one of our clients using our EHR. And then what we use is a cloud environment, because we strongly believe that AI innovations should not be the domain of only one supplier. So our clients are able to hook up any AI model that they wish to using a cloud solution. And then we make sure that they can take all the information that they need from the EHR, transport it to the cloud environment, and then provide the correct output from the model. And it leads to all sorts of interesting innovations. And this is an example. And in this case, it's good that I actually studied English literature, because it's kind of a tongue twister. The continuous automated medical record-based detection of possible familiar hypercholesterolemia. I'd like to try and challenge you in repeating that 3 times. It is a tool. It sounds very complicated. What it does is really simple. It was developed with ChipSoft and one of our clients, the Northwest West Clinics. And what it does, it goes through all the data available in an EHR, and it detects people who have a risk of suffering from a rare heart disease. And this is a disease that will kill you if your doctors don't notice it. And it is hard to notice it because it involves a lot of data. And it's a model, it runs in the background, and as soon as the doctor opens his software, he will get a notification. The following 4 or 5 patients might possibly be suffering from this rare disease. Please contact your lab and perform the following tests so that we might determine if this is the case. And this is something that was conceived by a doctor in Alkmaar. It was designed and implemented by ChipSoft, and it is already running at this moment, and it really saves lives. So it's a really good example of how augmented intelligence and data analysis can help in making patients better and keeping them alive. This is a bit of Dutch. It's very impressive, but does it actually work does it actually work in theory? And that's the problem and the challenge I'm putting towards you, is that when you work in AI, or if you have ambitions to work in AI, you should always think of how you can practically implement your solutions so that it can benefit somebody on the work floor. An example is the prediction of medication. Now, this sounds like really simple software, and there are a lot of simple software rules in if I have an allergy for a certain type of medication, as soon as my doctor wants to prescribe that type of medication, it will give an alert. That's very simple. But imagine if my doctor wants to prescribe a set of medication, and the software is running on the background, and it helps him to determine, well, your patient is more than 44 years old, he is slightly overweight, he has some form of heart disease. You're at this moment only prescribing 4 types of medication. Usually for this type of patient, you would like to prescribe 5. So what this model does, it helps to assist the doctor by suggesting the missing type of medication, and in such a manner that it is presented within the EHR. And it is basic statistical analysis, it runs on the background, but it just helps the doctor in using the right set of medication. And this is an example of how this type of clinical decision support using augmented intelligence runs on the background and helps to assist or nudge a doctor or nurse in providing the right type of care. Another example is the complication prediction. Now we're getting more into the area of actual artificial intelligence, and at ChipSoft we have a multidisciplinary team. It consists of both data scientists, data engineers, the people who code our software, our implementation specialists, the people who talk a lot like me, And what we do is we focus on a problem. We try and get an actual problem from the workflow and try and see how we can solve it and implement it in our software. So when a patient sees a doctor, there's usually a reason. He's either sick or he has an injury and he needs to be treated. Now, if a person needs to be treated and undergo surgery, there are a lot of factors that determine whether this person will get a surgery and he will be okay or he will suffer a complication. And by looking at all the data available in the EHR, both age or weight or the history of the patient, we can detect and predict what type of complication and the chance of complication that will actually be there. Now, what we did is we looked at a lot of different types of machine learning algorithms, like a neural network or other types, and most of them were discarded because they did not perform like we wanted them to. And eventually we settled on a random forest classifier for the complication prediction because it had the best combination of both accuracy as well as running efficiently in our software. And what this complication prediction achieves is when you are being seen by your doctor and you're being admitted or the surgery is being planned, as you can see at the bottom of the screen at the clinical decision support widget, we can both predict the missing medication as well as the chance that you will suffer a complication during surgery. Now, we can predict this both before the surgery, or we can predict the chance you will suffer a complication after surgery, like some form of bleeding or another type of complication that could, for instance, lead to you being readmitted to the intensive care. Now, this is very important information because if you know that your patient has a 87% chance of having a complication, it could lead you as a doctor to decide that the patient might be better on the intensive care, being monitored a little bit better than usual. So what it also does is not only help predict the chance of complication, but also manage the workflow within a hospital and making sure that you can allocate resources more efficiently. Because the patients that are at no or low risk of complication can be sent home earlier, and the patients that are in the higher risk group can be monitored more closely. And this is really helpful for doctors and specifically surgeons to help manage the direction or the destination of patients after surgery. So, overall, some take-home messages, and these are specifically focused on how you, as a student or somebody who might have finished your study, would go about trying to find a work or an interesting employment opportunity within artificial intelligence in healthcare. So the first thing is, and it is the most important, it is technology and view it as a tool, like any other tool that is available to you. The second is try and view AI as augmented intelligence and not artificial intelligence. It has very little artificial things about it. It is just some type of clinical decision support, like medication or like other tools that are available, and it is available as a tool set. And third is use the entire healthcare ecosystem. And that is one of the lessons we've learned from our successful projects, is that any AI implementation that has gone well is based on a multidisciplinary team. So we have both our data scientists, our data engineers, our software engineers, but we also have the doctors and the nurses. We also have the board of directors from a hospital. We have the patients who have something to say about the process. If you take all those people together and try and come up with an AI solution, it has a much higher chance of actually being successful. And the last and most important is that it is much more important to have some form of model that is actually usable, that you can implement in the workflow of a doctor or nurse, than something that is really unique. And it is something very counterintuitive for most people studying at universities. It is not necessarily about the innovation, it's about the practical application. Because a lot of very good ideas don't make it to the workfloor. And as soon as we get those very simple models implemented and working, and that the doctors and nurses can actually see the benefits, it will really help benefit and contribute to the acceptance of AI as a new form of technology in healthcare. So try and focus on the things that will work and it will work fast and easily.